It is not clear exactly why colorectal cancer develops in some people and not in others. Stages. The stage of a cancer defines how far it has spread. Determining the stage helps choose the most appropriate treatment. A commonly used system gives the stages a number from 0 to 4. The stages of colon cancer are: Stage 0, this is the earliest stage, when the cancer is still within the mucosa, or inner layer, of the colon or rectum. It is also called carcinoma in situ. Stage 1, the cancer has grown through the inner layer of the colon or rectum but has not yet spread beyond the wall of the rectum or colon. Stage 2, the cancer has grown through or into the wall of the colon or rectum, but it has not yet reached the nearby lymph nodes. Stage 3, the cancer has invaded the nearby lymph nodes, but it has not yet affected other parts of the body. Stage 4, the cancer has spread to other parts of the body, including other organs, such as the liver, the membrane lining the abdominal cavity, the lung, or the ovaries. Recurrent, the cancer has returned after treatment. It may come back and affect the rectum, colon, or another part of the body. In 40% of cases, diagnosis occurs at an advanced stage, when surgery is likely the best option. Diagnosis. Screening can detect polyps before they become cancerous, as well as detecting colon cancer during its early stages when the chances of a cure are much higher. The following are the most common screening and diagnostic procedures for colorectal cancer. Fecal occult blood test, blood stool test. This checks a sample of the patient's stool, feces, for the presence of blood. This can be done at the doctor's office or with a kit at home. The sample is returned to the doctor's office, and it is sent to a laboratory. A blood stool test is not 100% accurate, because not all cancers cause a loss of blood, or they may not bleed all the time. Therefore, this test can give a false negative result. Blood may also be present because of other illnesses or conditions, such as hemorrhoids. Some foods may suggest blood in the colon, when in fact, none was present. Stool DNA test. This test analyzes several DNA markers that colon cancers or precancerous polyps cells shed into the stool. Patients may be given a kit with instructions on how to collect a stool sample at home. This has to be brought back to the doctor's office. It is then sent to a laboratory. This test is more accurate for detecting colon cancer than polyps, but it cannot detect all DNA mutations that indicate that a tumor is present. Flexible sigmoidoscopy. The doctor uses a sigmoidoscope, a flexible, slender and lighted tube, to examine the patient's rectum and sigmoid. The sigmoid colon is the last part of the colon, before the rectum. The test takes a few minutes and is not painful, but it might be uncomfortable. There is a small risk of perforation of the colon wall. If the doctor detects polyps or colon cancer, a colonoscopy can then be used to examine the entire colon and take out any polyps that are present. These will be examined under a microscope. A sigmoidoscopy will only detect polyps or cancer in the end third of the colon and the rectum. It will not detect a problem in any other part of the digestive tract. Barium enema X-ray. Barium is a contrast dye that is placed into the patient's bowel in an enema form, and it shows up on an X-ray. In a double contrast barium enema, air is added as well. The barium fills and coats the lining of the bowel, creating a clear image of the rectum, colon, and occasionally of a small part of the patient's small intestine. A flexible sigmoidoscopy may be done to detect any small polyps the barium enema X-ray may miss. If the barium enema X-ray detects anything abnormal, the doctor may recommend a colonoscopy. Colonoscopy. Share on Pinterest. A colonoscope is longer than a sigmoidoscope. It is a long, flexible, slender tube, attached to a video camera and monitor. The doctor can see the whole of the colon and rectum. Any polyps discovered during this exam can be removed during the procedure, and sometimes tissue samples, or biopsies, are taken instead. A colonoscopy is painless, but some patients are given a mild sedative to calm them down. Before the exam, they may be given laxative fluid to clean out the colon. An enema is rarely used. Bleeding and perforation of the colon wall are possible complications, but extremely rare. CT colonography. A CT machine takes images of the colon, after clearing the colon. If anything abnormal is detected, conventional colonoscopy may be necessary. This procedure may offer patients at increased risk of colorectal cancer an alternative to colonoscopy that is less invasive, better tolerated, and with good diagnostic accuracy. Imaging scans. Ultrasound or MRI scans can help show if the cancer has spread to another part of the body. The Centers for Disease Control and Prevention (CDC) recommend regular screening for those aged 50 to 75 years. The frequency depends on the type of test. Prevention. A number of lifestyle measures may reduce the risk of developing colorectal cancer. Regular screenings. People who have had colorectal cancer before, who are over 50 years of age, who have a family history of this type of cancer, or who have Crohn's disease, Lynch syndrome, or adenomatous polyposis should have regular screenings. Nutrition. Follow a diet with plenty of fiber, fruit, vegetables, and good quality carbohydrates and a minimum of red and processed meats. Switch from saturated fats to good quality fats, such as avocado, olive oil, fish oils, and nuts. Exercise. Moderate, regular exercise has been shown to have a significant impact on lowering a person's risk of developing colorectal cancer. Body weight. Being overweight or obese raises the risk of many cancers, including colorectal cancer. A study published in the journal Cell has suggested that aspirin could be effective in boosting the immune system in patients suffering from breast, skin and bowel cancer. A gene linked to bowel cancer recurrence and shortened survival could help predict outcomes for patients with the gene, and take scientists a step closer to development of personalized treatments, reveals research in the journal Gut. A study published in Science found that 300 oranges worth of vitamin C impairs cancer cells, suggesting that the power of vitamin C could one day be harnessed to fight colorectal cancer. Researchers have found that drinking coffee every day, even decaffeinated coffee, may lower the risk of colorectal cancer. If you like this video, kindly subscribe in this channel. Baby Time FYI. Thank you.